Hello, everyone, and welcome to week 7. This week we talk about treatment issues, current trends, psychopharmacology. So a lot of big words, a lot of information. So I'm not going to cover this information to a lot of depth because we're providing a lot of resources. We began to talk about this a little bit earlier in the course. Particularly with medications and understanding, the more we understand about different disorders, the more medication that we have to offer. And so some resources that are here is to help understand that a little bit better. So there's some links to charts that you can find that list medications, different effects, different concerns, those that are more likely to be abused than others or misused. So make sure you get really familiar with those charts. They will be updated as we know more too, so make sure you keep going back to these. Why is this important as a counselor? Because likely you're not the one providing the medication or even recommending the medication, but you can help clients make some informed decisions. A lot of times clients are really unsure about taking any kind of medication. But you may notice that symptoms, anxiety symptoms, depressive symptoms, other symptoms are really getting in the way of even being able to apply counseling interventions effectively. And so there may be times that you recommend a psychiatric evaluation just to determine, and that might be a very short-term piece that can we get some stability long enough to introduce some coping skills and make sure that you're learning and applying those coping skills that can be effective. You begin to feel that they're effective before determining if that medication is something that's long-term or not. So there are many times where medication may be beneficial. There are other times when it may not be, that you really do want to focus more on just the counseling interventions and work with someone. So this is something that we really want to understand more about and know what are the different medications, what are the risks, and what are the benefits. And these charts are really good ways to have some information handy that if you're not a psychiatrist or a medical professional, that you can at least have some informed conversation. And then always recommend a client talk to their physician and their psychiatrist to talk about their concerns and talk about the effects of the medication. So this just provides you with a little bit of information because a client is likely to come to you first if they have a trusting relationship with you. So this will introduce you to some of the pharmacology out there and understanding that a little bit more, particularly when working with substance use disorders and co-occurring disorders. Another side of that is looking at, there are some medications that clients may be prescribed, particularly for anxiety, that do have a misuse effect, that they may trigger something in the brain that kind of leads to more and more and more use, and then may become a problem with a substance use disorder. That particular medicine that was prescribed, that was started to be taken as prescribed, but may have gotten misused over time. And sometimes it's intentional and other times it's not. For example, different people, based on their weight, their metabolism, their age, a dose might be prescribed that's going to affect them differently than someone else. And so again, that's why it's really important to collaborate with the physicians and the psychiatrists, because the only way they're going to know if the medication dose is effective or that potential for misuse is there is if there's some conversation between different providers as well as the client themselves. So that's another component of understanding these medications, and that's part of some of the charts and resources that you have access to. There's also information to understand about vulnerability within the populations. There are different risk factors that we look at. For instance, we saw an increase in rates of HIV infections in addiction populations, and there are a lot of reasons for that. There's more high-risk behaviors that are being engaged in, as well as needle exposure, those things that led to a higher rate of infection. And so most treatment certifications, there's a requirement of having specific education with HIV and other infectious diseases because of that prevalence. And so you'll be introduced to a little bit of that here too. Other topics is really understanding gender differences. Different interventions need to be applied differently. There's some factors with women that are present and need to be addressed that are different than men, and those need to be addressed too. So this week we really introduce you to several of those understandings. Again, there's a lot of information. Sam says a good place to look for that and stay current on those new components. And you may find yourself wanting to specialize in certain areas of these risk factors. So it's important to know, even if you don't specialize, where those vulnerabilities and risk factors are. There's also a lot of legal resources and understanding. Different states regulate substances in different ways as far as the consequences for possession or use, understanding the effects of children that are in a home where there are substances and what does that mean for child protective services. Each state is different and responds differently, so make sure you know your state and make sure to know programs. And we introduce you to a few of those, drug court, understanding different parenting programs, different ways to approach those specific circumstances. So again, we need to look at the needs of the individual that we're working with and realize that their addiction disorders isn't just affecting them. There's usually others in the family and in the community. And so having an approach that addresses all of those factors is really important, and several of these resources are provided, so you have a perspective on that, such as what are the benefits of a program like drug court or pretrial intervention programs, parenting programs that include the child and the whole family unit. So you'll be introduced to some of those. There's a piece to understand about ethics, and we're familiar with the ACA ethics, and we refer to those a lot throughout your program. When you're working with the addiction population, there's also a code of ethics that's published by NADAC, and that's the Addiction Professional Network, our American Association. And so I recommend you being familiar with those. Even if you don't specialize in addiction counseling, it's still good to know what those codes say. You may, if you don't have a certification through them, you're not necessarily bound to those the same way, at least in response to certification or licensure. It's still helpful to know the information, so take a look at that. We provided the link for you. Another thing that we're looking at currently, and I've kind of talked about it a little bit throughout, is language. And as we know more and more about addiction, particularly that the disease of addiction, the more we understand that our language as professionals needs to shift. And so we've adopted a lot of the language from the clients that we serve. A lot that are involved in community support groups and have that culture and that language that's perfectly acceptable and fine for that particular culture. But as professionals, we need to make sure that we are presenting language that reflects the disease that we're treating, that really reflects a professional and clinical perspective. And so the ATTC has developed a chart. It's Language Matters, and so I included that, and it helps break down kind of as a field the language we're moving towards. For example, a lot of people may reference clean time, right? Well, when you think about the disease of addiction, is that really a clinical term? we understand what it means, and the individual we're talking to does, but as professionals, we want to have a different language for ourselves. We don't need to force a language change for our clients, but as professionals, we would want to more reflect what that means clinically. And a mentor that I've been working with for a while, he kind of talks about it in the sense of, if someone who just had an MRI that was positive for cancer, would you say, oh, that's a dirty MRI? Or someone who's in remission, well, you have a clean MRI. I know we would talk more specifically and with those specific factors. So similarly, when we're talking about drug screens or different things, we want to reflect clinical language. And so take a look at that chart and see what that is. You have a quiz this week. It's a very comprehensive quiz, so take time to study for that and take your time to work through it. It covers the whole course, so again, it is pretty comprehensive.